Good morning, everyone. I'm Nabeel Mohammed. I'm an associate professor in the Electrical and Computer Engineering Department at North-South University. Today, we are presenting a conversational chatbot, Meno-Chat. It's supposed to be an assistive chatbot, providing information about menstrual problems and menopausal health situations for women. We've heard this from previous presenters. I don't want to rehash the same information, but one of the most important things that we can provide is information, particularly authoritative, factual, true information to girls and women who are going through either menstrual health issues or menstruation in general or menopause, to help them through the time, to empower them through information, but also in a way that does not necessarily enforce or bring into the social stigmas or the barriers in the conversation that already exist within society. So there are many studies that would show that as children or girls are getting more educated, they have better access, or they demand better access to menstrual health or menstrual management. Menopausal information, menopause-related information is scarce to find, particularly in Bangla. It's very, very hard to find. So without getting into the same information presented by others, what we are really looking to do is we'd like to take the human factor, initially at least, out of it, at least for the conversation. That is, if someone has trouble conversing with another person about getting information, we'd like it so that they can have that conversation without any feeling of shame or any feeling of barriers. So that's why this chatbot has been proposed. Now, all of us in the last few months, we've obviously seen the emergence of these conversational agents, particularly things like ChatGPT. What we are simply proposing is a chatbot which is domain constrained. So it is a chatbot, it is a conversational chatbot, it will be multimodal. What we mean by multimodal is people don't necessarily have to type. They can if they want to, but if they want to, they can engage with it through speech. They don't have to use an app. Once a conversational agent is created, you could engage with it through, for example, a helpline. But the idea is to create this chatbot that someone can have a conversation with, and hopefully this chatbot can provide almost human-like responses. But the real technological trick here is to make sure that these chatbots, or at least particularly this one, does not have the same problems that exist in these popularly seen chatbots from Microsoft, OpenAI, which is that of hallucination or sometimes providing false information. So one of the things that we prefer is to use a technology which is a retrieval augmented neural network language model. So this is not a language model similar to what you'd use in ChatGPT, which is prone to hallucinations, but it is something which is grounded on data. And as long as we are providing authoritative and correct data, the neural network will essentially present that data in a digestible format for the user. So why is it novel? Well, it's domain constrained. So that means that we don't have the rather challenging task of trying to give answers to every possible set of questions. We would like to constrain ourselves to the domain of menstrual and menopausal health. This will unfortunately use a very large language model to do this. So it will be computationally expensive, but you need to train it once, and then you can use it for some time, and periodically it will need to be updated. Now, catering for all women, we've written it here, but really what we mean here is you don't need to be able to type, or you don't even need to have access to a mobile phone, a smartphone, to access this. Once this dialogue-based chat system is created, you could hook it up with a helpline, and then someone can just call up a number and have a conversation with it. However, with the technology that we have developed, at least in North-South with our industry partners so far, it will be restricted initially at least to modern standard Bangla. We probably don't do very well with regional languages yet, But as long as someone is speaking mostly close to modern standard Bangla, our conversational systems understand people quite well. Personalization, obviously, as the conversation proceeds, some amount of personalization can be done within the conversation. Appropriateness, because we will ground it in authoritative sources of information, we can try to make sure that it does not provide unethical or controversial information. There is no, at least in the final version, there is no human in the loop. It is just the person interacting with the system. Data may be stored for auditing purposes, if that is what the policy is, but it doesn't have to be. We won't require people to sign up with personal information. In fact, we won't even require people to sign up. They just need to start a conversation. It's aligned with, I think, some of the steps that the Bangladesh government is already taking. Feasibility, well, the technology is well understood. It's a bit expensive, but it's well understood. Information can be found. They may need to be converted to Bangla, but the information exists. Authoritative and correct sources of information exist. So we just need to gather them and maybe translate them to Bangla. Data annotation needs to be done, and scalability is an issue. Within the study, so we'll need to do some data collection. Obviously, the neural networks will need to be trained. That is the challenging part. Getting the right sources of information will require engagement with domain experts and researchers. That's something that needs to be done initially, and will be in NSU. When we submitted the proposal, we submitted with an industry partner so that we do the machine learning R&D at North-South. We partner with domain experts and researchers, and the eventual product will be developed with our industry partner. And the outcomes I'm hoping is that if we can get this done, we will hopefully have a positive impact in all of the cities.